Assalamu alaikum. I am Dr. Silvia Paroi, Assistant Professor of Community Medicine Department at the Akij Medical College, Khulna. In previous lecture, we shared the lecture of environmental health, that is water purification in large scale purification. First step was storage, then filtration, and we discussed about the filters, rapid sand filter, slow sand filter. Today we start third step, disinfection. Disinfection also have some criteria, like it should be capable of destroying the pathogenic organisms within the contact time and not influenced by physical and chemical properties of water, that is temperature, pH of water and mineral constituents of water. It should not leave products of reaction which render the water toxic or impart color or otherwise make it impotable. Then it have ready and dependable availability at reasonable cost. The property of leaving residual concentration. It also have the criteria that required in a small quantity to permit the efficiency. Now we see chlorination. It is supplement, not a substitute to sand filtration. Chlorine kills pathogenic bacteria, but it has no effect on spores, protozoal, cyst and helminthic ova and certain viruses, like example polioviral hepatitis, except in high doses. It oxidizes iron, manganese and hydrogen sulfide. It destroys some taste and odor producing organisms, constituents. It controls algae and slime organisms and aids coagulation. Chlorination have some principles. The water to be chlorinated should be clear and free from turbidity. Chlorine demand of water should be estimated. Now we have to know what is chlorine demand. The chlorine demand of water is the difference between the amount of chlorine added to the water and the amount of residual chlorine remaining at the end of a specified period of contact at a given temperature and pH of the water. Methods of chlorination. Now we see methods of chlorination. In large scale water purification, there have some methods, that chlorine gas, chloramine, perchlorone or high test hypochlorite. Other agent also need for water purification, that is bromine, bromine chloride, iodine, chlorine or dioxide, ozone, ultraviolet irradiations. Now we see what is breakpoint chlorination. Point at which the chlorine demand of the water is met is called the breakpoint chlorination. The presence of free residual chlorine for a contact period of at least 1 hour is essential to kill bacteria and viruses. The minimum recommended concentration of free chlorine is 0.5 mg per liter for 1 hour. The sum of the chlorine demand of the specific water plus the free residual chlorine of 0.5 mg or milligram per liter constitutes the correct dose of chlorine to be applied. Addition of chlorine to ammonia in water produces chloramines. If the chlorine dose in the water is increased, a reduction in the residual chlorine occurs due to the destruction of chloramine by the added chlorine. This fall in residual chlorine will continue with further increase in chlorine dose. This point is known as breakpoint chlorination. Now we see what is superchlorination. Superchlorination followed by dechlorination comprises the addition of large doses of chlorine to the water and removal of excess of chlorine after disinfection. This method is applicable to heavily polluted waters whose quality fluctuates greatly. Thank you everybody.